Blocks account for almost, if I see 100 cases of infertility, almost 25 cases will have some tubal issues.
Okay.
Countries like India, which are developing, so the most common cause is infections. They don't have any symptoms, or when they don't feel like, they don't have fever, they don't have cough, they just neglect the tuberculosis.
Okay.
But generally, one family member, if they have tuberculosis, obviously there will be some form of transmission. Spreads retrospectively, from the vagina or the cervix, the infection spreads to the tubes, which blocks the tubes as well. Spreads retrospectively.
This is something that a patient has requested that we ask is, if one fallopian tube is blocked, what are her chances of getting pregnant? Is it reduced by 50% or what?
Yeah, so basically, this is a common question which all the patients ask. Like, I have one tubal block and the other tube is good. How should I proceed? So basically, in a menstrual cycle or in a normal woman, there is always, in first year of marriage, there is always 80% chances of getting pregnant. 2 years of marriage, there is 92% of getting pregnant. So what happens is, when your two tubes are good, consider it as 100% success rate. When one tube is gone, it's almost reduced to half. We don't know which side of the ovary releases the egg, like in which month, which side comes. If the right side is blocked and if the egg gets released from the right side, probably it may not result in a pregnancy to her. There is some theory called contralateral, where even if the right side ovary releases an egg, that comes through the left tube as well. There is a theory, but even then the chances of getting pregnant are less. So instead, if one tubal block is there and all the other parameters are normal, I'll always advise them go for a laparoscopy. And if you feel the tube has cleared and both the tubes are good, you can try naturally or some other methods like timed intercourse or IUI. But it depends on multiple factors, age, male partner analysis, and look at her hormone values, AFC count, the egg count, how much is the woman having. So multiple factors should be taken into account before deciding a treatment on a patient.
There was one talk that I saw where the doctor mentions that even if the fallopian tube is not blocked, sometimes the fallopian tube itself might not be like this, or it might be bent like this, in which case it's as good as being blocked.
That's what, when there is a history of infections, or when there is a condition called endometriosis. So basically what happens is your endometrial tissue or some form of tissue which should be in the womb gets implanted somewhere in the ovary or somewhere in the abdomen. So that disrupts the anatomy or the position of the tubes. Even then, the tubes may be open, but what happens, instead of having a wavy pattern of the tubes like this, they'll be like this, or they'll be like this. So what happens, even if the egg releases from the ovary, it won't be entering the tube, number one. Number two, if the tube has become like this, the egg can't go into and move all the way and reach the middle part of the tube for the fertilization to occur. So always in such conditions like endometriosis or some form of infections, so even the tubal anatomy gets distorted. That becomes a major issue. So when the partner's analysis is good and the tubes are blocked, I always advise them, if the other parameters are okay for the woman, go for a diagnostic hysterolaparoscopy if the marital life is also not more than 5 years. So if everything goes well and the tubes get cleared, we can always ask them to try naturally for 3 months or 5 months. If they are not getting pregnant, then we can always advise an IUI as well. So yeah, that's an option. If all the other parameters are okay, and if she has a blocked tube, you can attempt a laparoscopy, try to clear the tubes. And if the tubes get cleared and there is no other any abnormality, we can always give them an option of IUI.
So if both the tubes are blocked, no chance.
Yeah.
Straight away IVF.
When both the tubes are blocked and we are unable to clear it, then the only option is ICSI or IVF. We call it in vitro fertilization. So basically, you take the eggs. You stimulate the ovaries or the egg, and take the eggs outside from the woman body, fertilize them with the husband's sperm in an embryology lab or IVF lab. Culture you get embryos, culture them to 3 days or 5 days. implant them back in the mother's womb. In this procedure, even if the tubes are good, bad, I mean, it doesn't matter to us when the patient has decided to go ahead for IVF.
You've purchased the underwash machine from us.
Yeah.
Are you using it?
Yeah, I'm using it in my rural Parvatipuram center. That's good. The layering and all is good. Basically, even the layman or small technician is able to do it. I'm happy.
Okay. And have you had any success? Because I saw that you've
Yeah.
used YouTubes.
I had, I think, 2 or 3 pregnancies getting positive.
Oh, how many tubes used?
I think we have used 10, I think. I mean, the count, I'm not sure.
Great. So it's a very compact, efficient machine.
Yeah, yes, agreed.
Well, I'm glad you have good things to say about the underwash machine. So we have hospitals who are working with us with the We Conceive home insemination kit. What they do as a first round of treatment is to recommend the home insemination kit, obviously not to all the patients, but the selected patients who they think will benefit from the home insemination. So Dr. Dheeraj, from what you have said, even if the woman's tubes are blocked, it's a non-life-threatening issue. And if her husband's semen count is so bad, then you straight away advise the couple to go for IVF. And if the partner's semen count is good, everything else is good, but the wife has got a blocked tube, then her chances of getting pregnant is still good. Well, Dr. Dheeraj, thank you so much for your wonderful.
My pleasure, my pleasure.
Yeah, from Subhag Health Tech, we wish you the very best in the family-run setup.
Thank you.
And may your startup grow from strength to strength, and may you be able to help so many people in your area.
Sure, thank you, madam. Thank you. And please visit our center whenever you are in Vizag or any of our subscribers come. Please visit our center. We have done it absolutely in high-class standards. We brought high-class machines, high-class incubators. So all of you are welcome to visit our center, experience our center. We'll be happy to host all of you.
Wonderful, that's wonderful. And I have no doubt that it'll be international class. I have no doubt about it. Well, thank you so much for your time. God bless you.
Thank you. Thank you so much. Yeah. Bye.
Bye.